from the American Academy of Pediatrics.
Reading to children lays the foundation for social, emotional, cognitive, and language development.
A new policy from the AAP offers ways pediatricians can use books to assess the growth of their youngest patients.
Oh, look, the 6-month-old can sit up unsupported, grab the book with his fist, and get it to his mouth. Oh, look, the 2-year-old can turn individual pages.
Plus, Election Day is a week away, so it's time to get out the vote.
Up and down the ballot, there are candidates who shape policies that directly impact the health of young people, families, communities, and it's really one of the most powerful tools we have as pediatricians and child health care providers to make a difference.
These stories and more on Pediatrics on Call, the podcast on children's health from the AAP. I'm Dr. David Hill.
And I'm Dr. Joanna Parga-Balinki. This podcast is for everyone in the medical community, keeping our children healthy and safe.
It's a show by pediatricians for pediatricians.
But anyone who cares about kids will get a lot out of it as well.
Let's start today's episode with a conversation about the many benefits of early literacy.
David, you know how much I love to read, and my daughter Mira started to read in kindergarten. I often wonder how much my parenting makes a difference versus how much is just my child learning at their own pace. But I was talking to my mom about Mira and her reading. She said, well, you've always read to your kids, so it makes sense. And it made my heart melt when she said that.
We talk about adverse childhood experiences and generational trauma, but Joanna, can I just say what your mother told you sounds like generational affirmation and support? I am proud of her for saying it and proud of you for having recognized the importance of reading.
I mean, sometimes it's wild to me that reading to your baby or young child is so transformative.
Oh, but it so is, not only for their literacy, but for the joy it can bring, both the parent and the child. I remember when my kids were little, I'd always read to them and do different voices, and I still remember how much they'd giggle when I'd, be a bear or a little old lady. Seriously, pure joy.
So it's with that pure joy that we welcome Dr. Perry Klass to the show. She's been on the podcast before, talking about storytelling from Italy, and also shared her own story in one of our Pathways to Pediatrics.
She's a professor of journalism and pediatrics at NYU, the national medical director of Reach Out and Read, and first author on a new policy statement and technical report in pediatrics entitled Literacy Promotion, an Essential Component of Primary Care Pediatrics. Dr. Klass, welcome back to the show.
Thank you so much. I'm so happy to be here.
Before we talk about literacy, can we talk about early relational health? What is it, and how early can you start relationship building with your child?
I think everyone who's had a baby knows that the relationship building starts even before birth, as that baby becomes a person in your thoughts, as you fantasize, as you dream. Probably everyone who's welcomed a child knows that, but certainly we think about the relationship building that begins from birth, from the time a child comes into a family, with the parents, with the caregivers. And I think what we want to say about that is those relationships, those loving relationships, that responsive world, which for a child is the adults, the mother, the father, the caregivers. That's how children grow, that's how they develop, and that's how they learn. And everything that we think about in early childhood development happens in the context of those relationships. And that's why when we think about early relational health, we're thinking about issues which affect pretty much every aspect of the child's health and well-being.
And so how does reading promote early relational health?
Well, I'd start by telling you both to do what you already did. Close your eyes for a minute and think about reading with your children, especially when they were young. And there you are, and they're on your lap. You're in physical contact. You're talking back and forth. Not only that, but you're not, when you live with a young child, the language exposure is tremendously important. That's how children learn language. But we all know that a certain amount of the back and forth with a young child is, no, you really have to put your socks on. No, no, you have to keep your socks on. We know there's a lot of back and forth, which is necessary and kind of logistical and sometimes even a little bit repetitive. And I think that books and stories, they're our chance to do language, rhymes, silly voices, as you were saying, stories that open up the world, even with very small children. And so here's what it is. Reading together with a small child is a positive, warm, loving, and language-rich interaction. It's a way to build that into bedtime, build that into transitions, build that into your day. And so there's the magic in it is really you. The magic in it is the relationship. The magic in it is that you're the person with that incredibly important voice in your child's world. And there you are using that voice to read a story, ask questions about the pictures, and open up the world.
Well, Perry, I think that primary care pediatricians are magical, but they're also in busy clinics. How do they prescribe reading to their families and make sure that their families are reading together?
So I have to tell you that the wonderful thing for me about these many years now that I've worked with Reach Out and Read has really been the reception and the leadership from pediatricians, because everything that we're saying back and forth about those early relationships, everything that we're also probably going to say about the importance of early experiences and early trajectories and how they can shape a child's whole life, that's something which people who take care of children all day, which pediatricians really get. And the opportunity, for example, one of the things with Reach Out and Read, right, we give anticipatory guidance and advice about reading with a baby or a newborn or a 2-month-old or a 4-month-old or a 1-year-old. And we also give that beautiful, developmentally appropriate, culturally appropriate book. Well, when you do that, you think about the book going home with the child. You think to yourself, I've just helped this child live in a house that has a beautiful, colorful book in it. I've given this parent something to do tonight at bedtime. And I think it's something which pediatricians get so quickly and so completely that really the growth of this program, which honestly, back in the beginning, sometimes the growth exceeded our ability to support it, because people wanted to do it. And I think people want to do it because pediatricians are pediatricians and they totally understand the appeal of something which on the one hand is giving a parent a strategy for bedtime tonight with a toddler, but on the other hand has a reach which extends forward into that child's potential in school years from now. And I think that combination really speaks to pediatricians.
Families can feel so busy right now that they feel like maybe they don't have time to read to their children. How do we help them find that time?
I think that's a really good question. I think it's about supporting parents and emphasizing to parents the centrality, the importance of those relationships and that back and forth and of their voices. And maybe especially for parents who are, for one reason or another, less sure of themselves, first-time parents, parents who are far from their own support systems. It's, the world is full of people out there marketing aggressively to parents in ways that suggest you need something formulated by experts if you're going to build your baby's brain, but what your baby really needs is you. And I think that's a message which comes very powerfully from the pediatrician. It's you. This really matters. It's something that you build into your everyday, and you're doing something wonderful, something important. And I also think that once parents start doing it, it's kind of self-reinforcing. That is to say, as you both know very well, if the 2-year-old will only go to bed after you read Goodnight Moon 5 times, you will read Goodnight Moon 5 times. You may occasionally try to vary it with mixed success, But if that's the way that bedtime works, or if that's the warmest, happiest time of your day, or if when you're completely exhausted from chasing your 2-year-old twins around the house, as one mother who I took care of her twins, and she told me that when I can't chase them anymore, I just sit down on the floor and open one of those books, and they come running and start climbing on me, but I get to sit. And I think that idea that your children let you know how much they want you. They follow you around the house with the book. And when they're following you around the house with the book, if it's a 1-year-old and she keeps, poking at you with the book, she's not saying vocabulary practice. Mom, Dad, there are other kids getting ahead of me. She's saying, stop whatever irrelevant adult thing you're trying to do and take me on your lap and use the voice that you use when, just like Dave was saying, make the bear voice, make the mouse voice, hold me close and do this. And I think if you've got the child asking and you've got the parent enjoying, then these are interactions which get repeated. Even so, I totally grant what you say. There's a lot of stress on families. There's a lot of pressure. And we have to say there are a lot of competing forms of entertainment. And part of our message, and this is not limited to reach out and read, part of our message in pediatrics has to be about the importance of those relationships and the face time and the lap time and the meal time and all of the opportunities that you can build into your day to be interacting back and forth in positive ways with young children. It's a hard job.
Building off of David's question and to take the onus off of families for a second, the AAP itself is recommending pediatricians promote literacy development as an important evidence-based intervention, and they want it to begin in the newborn period. But are there things federal or state governments can do to help pediatricians and families in this endeavor?
Well, I think many pediatricians will want to know that one of the most important things that we emphasize both as a policy recommendation and also go into great detail about in the technical report is funding support. I mean, we want this to be available to all children. We want the time and effort that pediatricians put into this, counseling about early literacy and early relational health and using early literacy counseling to promote early relational health. We want it to be a universal primary prevention strategy, if you will. We want every child to have the blessings of it, but we want that to be supported both in terms of funding for books and funding for pediatrician time and funding for infrastructure as the vitally important intervention that it is. And so we put a lot of time and effort in developing the policy statement and the technical report into tracing the different routes there are for funding support, but also into making the recommendation that there absolutely should be funding support.
During your time as National Medical Director for Reach Out and Read, what national or statewide interventions do you think have made the greatest difference in getting kids into books?
So I think the most hopeful, most optimistic interventions are the collaborations, where you've actually got citywide or statewide multiple agencies thinking about the messages that parents are getting, where you're including the pediatricians in a larger effort to get people thinking about early development, to touch parents in many different venues at many different places. And we detail some of those because I think we have tremendous power and impact as pediatricians, but as I say, I think this is a hard job every day for parents, and they need encouragement, they need support, and they need the opportunity and I say the tools, the books, and the materials. So I think it's collaboration across platforms. It's thinking about who else is important in the life of families with young children, early childhood educators, clinics, but also the places where parents are getting their health care. It's an opportunity for the medical home. It's an opportunity for the library. It's an opportunity for the community. And I think the more we do it together, the less parents will feel that they're out there on their own.
So, Perry, full disclosure, I have been a part of a couple of reach out and read practices myself, and my favorite part of participating is when I get to read to a child myself. Can you talk a little bit about how we can use modeling to show parents what this is all about?
That's probably the most important thing you could do. We actually have a recent study that we were able to include in both the policy statement and the technical report, looking at what is most effective, and modeling by the pediatrician is maybe the single most important thing we found. And I'd say a couple of things about that. I'd say that for many families, the idea of reading to very small children is new, even regardless of, say, what parents' cultural and educational background is. They may not think in terms of reading to a 6-month-old or a 1-year-old or a 2-year-old. It may, in their mind, be something that, happens with older school-age children. So when you model and you show the techniques, for example, that you don't have to read the whole story, that you point to the pictures, that you ask questions, that you use funny voices. And David, if you'd like to show us some of your funny voices, right? But you go ahead and loosen up and make the cow moo and, demonstrate the back and forth. And then I think that segues really well into the message, but who he would really like to look at this book with, who she'd really like to make the animal noises with because of who you are in her world. Such an important message to the parent or the caregiver. But yeah, part of what we're trying to say here is take full advantage of the books in your exam room. We've got a lot of ideas for how you can give the child the book and then do a great many pieces of your developmental assessment. Oh, look, the 6-month-old can sit up unsupported, grab the book with his fist and get it to his mouth. Oh, look, the 2-year-old can turn individual pages. Oh, look, this is the 4-year-old who can answer all the questions about what color is this and what does the cow say, and then can put some sentences. Use the book for the things that you're already doing in your exam room to get a sense of the child's developmental situation, to talk about bedtime. I mean, how many of us talk about bedtime every day in the exam room with the parents of toddlers? So fold the book in when you talk about tantrums, when you talk about distraction. Use the book. You've got it there. And that, like the modeling, that gives parents a sense of how the book can really play a role in the child's life and in everyday life with a very young child.
This policy statement has so many suggestions about how we can help our patients connect with their kids through books. Do you have any last takeaways for our listeners before they go, well, reach out and read it?
Again, I want to convey my incredible gratitude for, we all know that it's a tremendous privilege to take care of children and to be allowed into families' lives. I'm also very sensible of the privilege of having been allowed into so many pediatric clinics and practices. And when I think about the country, when I think about places I've been, I see these amazing clinics, these amazing offices where people really, really care about children and how they grow up. And I think everybody understands that when you give a child a book, when you talk about reading with a child, parents see it as a statement that you believe in that child as a future reader, as a learner, that you believe in that child's brain. And I think that we all understand that, on the one hand, the books are wonderful for bedtime tonight or for story time this afternoon on the bus on the way home from the clinic. But I think we also all understand that they are a gesture of faith in everything that children can become and that parents and caregivers want to help their children become.
That is so inspiring, and I'm going to take it, funny voices and all. Dr. Perry Klass, thank you so much for joining us today.
It was my great pleasure.
To read the policy statement and technical report, literacy promotion an essential component of primary care pediatrics, visit our website at aap.org/podcast.
Coming up, we'll look at the importance of voting in the federal, state, and local elections of November 2024.
Joanna, have you voted yet?
Not yet, but I do have a voting plan. I'm not on service on Election Day, and my kids have off from school. The polling place is just 3 blocks from our house in Philadelphia, and we like to bring the kids and see our elected officials from our ward. And wards in Philadelphia are sort of like political districts, and we're in the first ward. So it's fun for us to be out and about on Election Day and teaching our kids how important voting is. What about you, David?
I have. We went out last weekend with both the girls and made an event of it. Wilmington is seeing record numbers of early voters with lines around the parking lots.
We've been covering child health since the last presidential election, if you can believe that. And it's clearer than ever that voting affects health. That's why the AAP's nonpartisan Vote Kids campaign is such a critical effort.
And there is still time to act. Let's get some inspiration from our next guest, Dr. Lisa Costello, an old friend of mine and a leader in the AAP's Get Out the Vote efforts.
Dr. Costello is the chair of the Committee on State Government Affairs for the AAP and assistant professor of pediatrics at West Virginia University, where she serves as a pediatric hospitalist. Lisa, welcome to the show.
Thank you so much for having me to talk about something that I'm really passionate about, and that's getting out the vote.
Well, we are passionate about your passion, and we'd love it if you could put this in context for us. So why would an organization dedicated to children's health and well-being spend so much energy encouraging people to vote?
As pediatricians or individuals engaged in caring for children, we really prioritize child health, and voting is one of the most powerful tools that we have to help impact decisions that impact the individuals that we care for. So up and down the ballot, there are candidates who shape policies that directly impact the health of young people, families, communities, and it's really one of the most powerful tools we have as pediatricians and child health care providers to make a difference.
I know every election feels critical, and you started to talk about this, but are there aspects this year that make it especially important for children and family health?
It's so important because it's a presidential election year, and we know that there tends to be higher voter turnout in election years where there's a president on the ballot. However, as the Committee on State Government Affairs, we look at issues down ballot, and there are so many different positions up and down the ballot that impact child health. I have a 2.5-year-old who recently started school, pre-K. And so how many people know who's running for their Board of Education or comparable in their local level? Many decisions that get made there impact children, maybe the ones you care for or your own children. And so there are different positions up and down the ballot that impact child health. And it's really important. We know just at the state level, there are thousands, literally thousands, close to 5,800 elections at the state level of different positions that could impact child health. So we see a lot of the ones at the top of the ticket. However, I really encourage people to look down ballot and know all the different positions and have an informed voting plan. I'm so glad that you have one, Joanna, and it sounds like, David, you already have cast your ballot. But it's really important to know up and down the ballot who is running and what policies are at stake so that you can make an informed decision when you go to the polling place.
So I think politics in general can be hard to talk about, and perhaps even harder in the medical setting to have this conversation in a way that's not awkward. What tips do you have for pediatricians who want to encourage voting but aren't sure how to start?
Well, as we shared, I think it's really important to emphasize that this is nonpartisan. We're talking about the importance of voting, and so it's important to bring it up with caregivers and also to bring it up with patients who may then get the opportunity to vote themselves once they become of the age to vote. So bringing up and asking, is a person registered to vote? Every state is different. So it's really important to know, are you registered to vote? And then this whole concept of having a voting plan. So Election Day is November 5th this year. However, in most states, you can early vote, as you already shared. So it's important to know when you can early vote if you're able to vote in your state. However, some tips I have to talk about it in the clinic itself is to just ask, do you know it's an election year? and are you registered to vote? Here are some resources that you can go to. One of those would be aap.org/votekids, where it has information. We also, with the American Academy of Pediatrics, have worked with the Vote ER group, where you can actually get QR codes and wear lanyards that it's very easy that you could show to the caregiver or the patient themselves, where they can check their voter registration status and also learn that other important information, such as, am I able to early vote in my state? Or where is my polling place? Where am I supposed to go when I vote? I've moved since the last election. So when I voted in the primary election, my polling place actually moved. So fortunately, my partner was on top of it, and he said, we have to go to a different place this year. So it's really important to have a voting plan and check, am I registered? And then where do I go to vote? So those are some of the ways that you can talk about it with your patients, is simply asking and then directing them to resources to help empower them to consider registering to vote. However, I think it's really important to keep this nonpartisan and more so as an educational opportunity, which is core to what we do in pediatrics.
And I also think it's really important that pediatricians know how impactful this can be. I heard there was a new study out about the impact of encouraging voting in healthcare settings. We love data on this podcast. Can you tell us what it showed?
So it's really important that there's multiple different groups looking at the importance of ensuring that we help get out the vote. And one of the recent studies has shown the impact that we as healthcare providers, notably pediatricians, can have when it comes in the space of health equity. And that we have seen that primary care providers, including pediatricians, are better at talking about this and ensuring that we get a diverse population, making sure that those who are typically marginalized, and we can promote racially and ethnically diverse populations getting registered to vote. And it is actually been found that pediatricians and those primary care providers are better at doing so in talking about this and making sure that we are promoting everyone who is eligible to vote is using that impactful, real, powerful kind of responsibility that they have with voting.
As pediatricians, I know we want to set an example and vote for candidates who will prioritize child health and well-being, but I also know we are super busy people. What can we do to make sure that we ourselves don't miss our opportunity to participate in democracy?
I'm so glad you brought this up. Joanna already talked about it herself as having a voting plan. I am actually on service during election day. So I've actually adjusted my voting plan because I'm worried I might get busy on election day and not get out in time to make it to the polling place before it would close. And I mentioned I have a 2.5-year-old. I remember going as a child to the polling place, and it sounds like you each have shared as well as engaging your family members in that. And so I want to make sure that I can take my daughter and we can go do that as a family, because that's something I fondly remember as a child. And so we're making our voting plan as a family as when we can go together to be able to cast our ballot, just in case I get a little too busy on election day when I'm on service. So having a voting plan first starts with, are you registered to vote? And in many places, the deadline may have already passed. So that's something important to know. If you weren't registered, make sure you get registered for the next election. However, making sure you're registered to vote is a really important first step. And then after that, it's knowing the details for you. Where is your polling place? Are you going to vote on election day? Are you going to vote early? Are you going to request an absentee ballot? And it's really important to have that voting plan so that you can make sure you're able to cast your vote. Then it's important to also look at the different individuals who are running for those positions. The AAP has many different policies that you all do a great job talking about on these podcasts over time. And so you can go to aap.org/votekids or just check out the website and see what is AAP's kind of evidence about a certain policy. And then you can help use that in regards to what you're determining might be the best selection for yourself. So we in the Committee on State Government Affairs, we always do our advocacy based upon policy. And I encourage individuals to turn to that to look to see what does AAP's evidence say about a particular issue. And then you make that determination of how that might impact your individual vote.
And before we run off to vote and encourage others to do so, Lisa, do you have any last takeaways for us?
One of the things that we didn't really talk about is, in addition to actual people getting elected to different positions, there's also issues themselves on ballots. And so it's really important to be informed as to what's at stake in this election in your state, and to use this powerful tool that we have as pediatricians and child health advocates to get out the vote and to encourage others to do so. So have a voting plan and check out resources available at aap.org/votekids and get out the vote.
Well, Dr. Lisa Costello, thank you so much for talking with us today.
Thanks so much for having me on.
To learn more about the AAP's Vote Kids campaign and what you can do, visit us at aap.org/podcast.
At the end of every episode, we like to leave you with something positive or enlightening. We call this segment Say Ah. David, what's your Say Ah this week?
Well, mine also starts not so but then gets Without getting too specific, our daughter Abby has had to face some unexpected, huge challenges in managing life and household and just adulting in general. And she is turning 25 this coming month, and I am blown away by how much maturity and responsibility and thoughtfulness that she's brought to this challenge. We know our kids are going to grow up and be fine, but I am amazed at exactly how fine and capable she is as a young woman right now, and it's inspiring to see.
Oh, well, happy early birthday to her. And my Say Ah is also about a birthday. My son just turned 5 years old. So
Simon,
yeah.
Happy birthday.
And it was the highlight of my day, actually, to go to his classroom and read a book to the other preschoolers that he's with in school. It was just so heartwarming and fun. And it's funny because I gave him a hug, but whenever I guess you give a hug to someone in his class, it leads to a group hug. So that was just like the best part of my day. And happy birthday, Simon.
Aw, what a sweetie. And he's getting big. Well, that's it for today's episode. If you like Pediatrics on Call, please subscribe on your favorite podcast app and help us spread the word. Follow us on Facebook and Instagram at Pediatrics on Call.
Pediatrics on Call is a production of the American Academy of Pediatrics. Our producer and editor is Ann Johnsos. Our audio engineer is Doug Nagel. Joe Puskars is our associate producer, and Susan Martin is our executive producer. Our theme music was composed by Matthew Simonson. Join us next week when we'll get the November research roundup from Dr. Alex Kemper.
We'll also talk to Dr. Ritu Banerjee about regulating antibiotics use in agriculture. I'm Dr. David Hill.
And I'm Dr. Joanna Parga-Balinki. Thanks for listening.